Good afternoon, guys. Now, discussion A this afternoon talks about the aftercare for resident to resident aggression. The trauma after somebody gets attacked by another resident. So, we're going to go through that this afternoon for A. So, please join me for the presentation I made. Here we go. Immediate trauma informed aftercare for resident to resident aggression means protecting the resident's physical safety first, ensuring a prompt medical evaluation, documenting and reporting the incident to facility leadership and adult protective services and the long-term care ombudsman, and then building a care plan that actively reduces re-traumatization while restoring the residents' sense of safety, predictability, and control. This kind of aftercare isn't just a regulatory requirement, it's a moral commitment to honoring the dignity of older adults, especially those living with dementia or other cognitive vulnerabilities. A trauma-informed response recognizes that even a brief aftercation can leave lasting emotional, psychological, and behavioral effects, and that healing requires both immediate action and sustained, compassionate follow through. Key immediate actions. First 24 hours afterwards, guys. These steps create the foundation for safety and accountability. Ensure safety. Separate the residents involved. Remove hazards and stabilize the environment. If injuries are serious or danger persists, call 911 without hesitation. Medical evaluation. A clinician should examine the resident as soon as possible. Request written medical notes and photograph injuries with consent or consent to preserve objective evidence. Document and reports. File a written incident report with the facility. Request copies of all internal documentation. Ask which state and federal regulatory reports were submitted and when. Note the names and titles of all staff involved in the response. These early steps protect the residents and ensure the facility meets its legal obligations. Trauma-informed principles to apply. CMS requires nursing homes to integrate trauma-informed care into everyday practice. These principles guide every interaction after an incident. Safety, prioritize both physical and emotional safety. A resident who feels unsafe may show new aggression, withdrawal, or confusion. Trust and transparency. Explain what happened, what will happen next, and why. Use plain, compassionate language. Empowerment, voice, and choice. Offer choices whenever possible. Where to sit, who accompanies them, when to rest, and even small choices rebuild control. Collaboration and peer support involve family, the ombudsman, behavioral health providers, and trusted staff. Healing is a team effort. These principles help prevent re traumatization and support recovery. Short-term aftercare, days 1 through 14. This period focuses on stabilization and emotional recovery. Environmental stabilization, increase observation, adjust schedules, or consider a temporary room change to reduce triggers. Psychological first aid, provide calm reassurance, validate feelings, and maintain predictable routines. Avoid forced debriefing, which can worsen distress. Care plan review, update the resident's care plan to include trauma triggers, preferred coping strategies, monitoring needs, communication preferences. CMS expects trauma informed care to be reflected directly in the care plan. Longer term supports, 2 weeks. Healing continues well beyond the initial incident. Trauma informed mental health referral. If symptoms persist, fear, sleep changes, uh, hypervigilance, withdrawal, refer to a clinician experienced with older adults and dementia related trauma. Behavioral in, Behavioral interventions for the aggressor. Address unmet needs such as pain, boredom, sensory issue, sensory overload, or hallucinations. Well-designed behavioral plan protects everyone. Staff training and system improvements. Provide refreshers on de-escalation, environmental design, and supervision strategies. review staffing patterns and routines to reduce reoccurrence, reporting, advocacy, and legal steps. Families and residents deserve transparency and accountability to report to facility administrator, um, adult protective services, long-term care ombudsman, preserve evidence, keep copies of all reports, photos, witness statements, and medical records, request timelines, ask for a written collective action plan, and a follow-up meeting within 48 hours to 72 hours. These steps ensure residents' rights are upheld and systematic issues are addressed. Slide ready presentation layout, 6 slides. Here is a clean structure you can drop directly in the training deck. 1. Title, learning objectives. 2. Why RRA happens, dementia, unmet needs, environmental factors, immediate response checklists, safety, medical documentation. 4. Trauma informed aftercare steps, short and long term. 5. Reporting rights and advocacy. Ombudsman documentation, prevention and staff action, care plans, training, environment changes. Folks, the other reason I did this show is because A, this happens in every facility, and B, if this happens to a family member of yours, if they're in a facility and this happens, this gives you a structured outline as to how to deal with that. Now, every state is different. Every state's requirements are different. So, if this happens to a family member that you have in your life, check out what the state requirements are, and my suggestion is not to sit on this incident. When this happens, don't sit very long on this, because the longer you sit, the more the person's going to have issues afterward. Being afraid of coming out of their room, being afraid somebody's going to attack them again, or being around the person. Make sure you isolate each person involved with the aggression. You have to find out what the root cause is first. Because for me, a person like me who has been in elder care for 30 some years, it depends on your situation. It depends on what you walk into. You have to dig into what's going on first to find out before you can fix it, before you can come up with a plan. But that gives you a kind of like an outline to start with. That is why I chose to do this subject today, is to help people understand that resident to resident aggression happens in every facility. It just gets swept under the carpet in most places. So you have to dig a few, like if it takes you a couple weeks to find out, a couple days. And if you notice a resident who's having flashbacks or something as to a fight that goes on, because let me tell you, resident to resident aggression happens with most memory issue, most um, people that have cognitive decline. Um, when it happens, they don't understand what's going on after the incident. So what you have to do as a person that takes care of them is you have to go through your plan for response. Like I said, every facility is different. So if you have this going on in your facilities, people, you have to go and do reviews every once in a while to see what you need to fix, see what you need to improve. And if you can, involve your residents, involve people that are living there, because if it's their because if you move a person into a facility and it happens in the facility that they're living in, um, residents have the right to be safe and to be cared for. Not and your job as people that take care of them, um, your job is to make them feel safe. But if you have residents who don't feel safe, you have to find out what's causing the issue and fix it. Now, if it takes you a while to do so, that's fine, but you have to make sure that things are up to date as to what plans are for those kind of responses. It matters, because being a resident in a facility, you're trusting somebody with your family member. You're trusting, and if it's a resident, they're trusting you to take care of them. But when that breaks down, everybody has to be um, aboard with each other. Everybody has to be on board with the care plan. Now, if there's somebody that has a problem with that, if they have a problem with how things are laid out, it's they have to deal with what's going on at the moment. Keep their keep keep their own feelings to themselves. They have to make sure that the residents are safe first. And quietly, if someone has a problem with the way things are laid out in the facility, quietly go and tell somebody, but do it quietly. Don't make a big scene out of it. Don't make it worse than it already is for people. Just wanted to do this one for a FYI for people's information, because it does happen around facilities. Like I said, it depends on the response team, and it depends on the compassion that you show residents if they come to you with an issue. Don't shove it under the rug. Make sure you take care of it when it shows up, folks. Now, if that means you have to move and adjust people, move them around, send them to different rooms. If their aggressor is in the same room with with the person that got attacked, you have to move them around. You have to relocate folks. I know that's that's a tough thing to do, but to save their safety and to make sure they're okay, you have to make sure that they have their own space and that they don't that they don't feel like fear. They shouldn't have any fear with the facility that they're in. If there's fear, go find out why. Take the time to go find out why. Take the time to make sure your residents are okay, folks. Because like I said, this happens everywhere in the United States. It just depends on how a facility handles the aftercare uh, for the resident to resident aggression. Okay, so that is your A for today. I'll be back on later tonight with shows. For now, Gator Wellness. Take care, folks.